You're one of the millions of Americans looking to enroll in Medicare for the first time or renew your plan. You may be overwhelmed with all of the options available to you. In fact, on average, individuals have more than 40 different Medicare Advantage plans to choose from. So how do you choose the plan that's right for you? Humana's Catherine Field and Dr. Kaisha Franklin join us now to help us sift through all of that information. So Catherine, first of all, let's start with this. What is Medicare and who is eligible for it?
Such a great question, because sometimes it's confusing about who and what are these plans all about. So Medicare is the federally funded program that provides health insurance benefits to those who are 65 and older or those who are disabled. Medicare Advantage plans are privately insured, privately administered programs through health insurance companies and offer similar benefits. The open enrollment period for choosing Medicare Advantage plan versus original Medicare starts October 15th and runs through December 7th. So lots going on in this space right now.
Yes, lots going on as people sign up or enroll or renew, but with so many different options, Medicare can be really confusing. Can you break it down for us?
Sure, I'll give it a go. Original Medicare is a program, as I described, federally administered program. As a consumer, if you're on original Medicare, you're going to pay 20% out of pocket for every service. You are also probably going to have to buy separately your Part D or your drug plan. Now, if you choose a Medicare Advantage plan, you're going to get everything that you do on original Medicare. So doctors, hospitals, emergency services, all covered, just like you would on original Medicare. You're probably going to get your Part D included in that plan. And then there's a whole host of supplemental benefits that are built around health and well-being and lifestyle choices. Probably one of the most important differences is that on Medicare Advantage plans, there's what's called maximum out-of-pocket protection. And so it says that over the course of the year, there's a predictable dollar amount that you will not pay any more than. Whereas on original Medicare, you're going to pay 20% on every service all year long. So those are the basics around the difference between original Medicare and Medicare Advantage, although there's many Medicare Advantage plans, so lots to try to figure out which plan is right for you.
And so, Dr. Franklin, when we are trying to decide between competing plans, what should people keep in mind when choosing a Medicare plan from your perspective as a physician?
Well, it's good to keep in mind when choosing a plan that you want to compare plans in your area because they can be different. And ultimately, you just want to make the plan, you want to choose a plan that meets your health needs, your financial needs, and your lifestyle needs. Also, it's a good idea to speak with your doctor just to make sure if you have any health risks, such as prediabetes, to make sure those potential treatments for diabetes will be covered. Also, it's good to make a list of your medications and compare those across plans. If you have a favorite doctor that you like to go to, just make sure that that doctor takes that insurance to avoid any out-of-network expenses. Also, to check and see if you need referrals for any specialist care. The Center for Medicare and Medicaid Services, they have a great review service where every year they review all the Medicare Advantage plans and rate them from 1 to 5. So it helps consumers make a really informed decision.
Anything else from your perspective as a physician that we should know about choosing that Advantage plan?
Well, yes. Well, definitely it serves a really special population, a lot of unique healthcare needs. So you need specialists and special doctors and caretakers for that population. We do tend to see with our Medicare Advantage versus our traditional Medicare that we have fewer hospital visits, fewer ER visits, and fewer readmissions. But overall, your Medicare Advantage does give more support, when you're navigating this difficult healthcare landscape.
All right. So, Catherine, where can we go for more information?
Yeah, so two great resources. One is the government website, medicare.gov. The other is Humana.com. Both of those have tools and resources to help sift through all the plans in your area. And then finally, if you want to talk to somebody live, you can at Humana.com sign up to talk to a licensed professional, either virtually, telephonically, or come and meet you in person to kind of work through all those various plan choices that are in your community. So lots to do, but December 7th is the deadline for signing up for Medicare Advantage plans for 2024.
Okay, great information. Let's put those dates on our calendar. Let's talk to somebody about what our needs are so that we can find the best plan for us. Catherine and Dr. Franklin, thank you for joining us today.
Thank you so much for having us.
Thank you.
Up next here, the Kingsburg Fire Department wrapped up Fire Prevention Week with an open house at Station 1. The technology they showed off and how they're continuing to push the message of fire safety after this.